Okay, welcome everyone. Assisi is loving the opportunity to pass along some great education while we're all sitting at home. Today's topic is destruction and reactive anxiety in adoptive homes. And our presenter is Dr. Jeff Nichol. Dr. Nichol did his undergraduate studies and graduated from the veterinary school at Michigan State University. He has been a veterinary hospital owner and has practiced general and behavioral medicine throughout his career. In 2015, Dr. Nichol completed his residency in behavior medicine through the American College of Veterinary Behaviorists. His current practices are located in Albuquerque and Santa Fe, New Mexico, and they are now limited to the diagnosis and treatment of behavior disorders in our pets. Medical comorbidities are a common feature in his caseload. We welcome Dr. Nichol.
Thank you very much, Carolyn. I have a special affection for folks who work in the shelter system. I've been there. I've done volunteer exams and prescribed treatment for many of these pets. I've done volunteer spaying and neutering. I was involved in a pilot study of a non-drug treatment to reduce anxiety in dogs in shelter systems. I understand, because I've talked to a lot of people, just like everybody who's here this morning, about how challenging this thing is. These pets, no matter how good the care that you provide, and I'll tell you what, these protocols, the physical facilities, and the people have gotten so much better in shelters. And despite all of our efforts to diminish stress and give them as healthy a time in that setting as possible, it's still stressful. And the anxieties that they have are one of the biggest reasons that they ended up getting surrendered to shelters. And in those really sad cases where you have succeeded in placing a pet in a home that you believe is going to work out for them, and then some of them come back. You get bonded to these pets, but you really don't want them back. You want them to live out an excellent life in a forever home. And so getting there with more of them is, well, that's central to what we do. And you folks are on the front lines. So, these are some of the stressors that are, foundational to the problem. These changes. Everybody likes routine, and dogs more than humans. Everything in their life, one event predicts the next. And well-adjusted dogs usually have that going for them. They've been set up for success in homes where they understand that they don't have to fear the next thing that might be lurking around the next corner. Well, they're in for big changes when they come into a shelter, and they're in for big changes when they go back out. And if they have an underlying anxiety problem to begin with, and so many of them have, partly because a lot of those are genetically programmed, and of course the changes that they've been through in homes that may have been less than ideal only fans the flames of these problems. And in many cases, the anxieties are manifest with destructive or just freaked out attempts to escape, separation anxiety issues. So, let's get into some of the ways that we can focus on educating pet parents, new people who may want to adopt a dog who's had some challenges. What should they be looking for? And this wonderful graphic was developed by my late friend and colleague, Dr. Sophia Yin. I know a lot of people are aware of her. She was wonderful, and we miss her still. These diagrams are pretty darn good. In fact, in some ways, these little cartoon characters get the message across better than photographs of real dogs, because you can focus on some of these individual behaviors. And these are the things that, if pet parents know what to look for, they can be proactive. They can get ahead of some of these problems. I know many of you folks have seen this picture. You can reproduce this, by the way. I've spoken with the Veterinary Information Network that owns this stuff now after Dr. Yin passed on, and they are perfectly okay with using this poster as long as it's not altered. So you're welcome to this, as it turns out. This is a video of a pet that I saw for separation anxiety, and I had these folks shoot this video when they were away from home because it illustrates a case where it might not be obvious when people arrive home. The dog is confined to this wire crate. Unfortunately, it's not covered, so from the dog's perspective, it doesn't feel much like a den anyway. And of course, the other big problem is that the dog doesn't have a choice to get out or go back in. It's stuck there, and that's not natural for dogs. By who they are and how they are genetically programmed to function, not only in a domestic situation, but in the wild also, they need choices. And by confining this dog to the crate, it has no choices, and it doesn't feel like it's in a den anyway. So the dog's doing its best to get the heck out of there, but because of this foam rubber pad and the fact that the dog has not fractured its teeth, which of course some of them do in these frantic attempts to escape, they didn't really know until I said, set up a video camera and take some video. And I'll tell you what, that opens their eyes. And that's something that I would encourage you to suggest to all adopters of dogs, whether they have a history of anxiety, whether they've shown the body signals that are suggestive of it, whether you have any reason to be concerned about it. Encourage people to invest $99 in a Nest Cam system, N-E-S-T, get it on the internet. You get 2 cameras for 99 bucks, plus you can set up an app on your smartphone to see what the pet's doing in your absence. And people can find out, well, should we be helping this pet? Well, maybe they should. One big study showed that 30% of dogs who had no history that people were aware of any kind of behavior issue, 30% of them, when people had their videos evaluated by a behaviorist, came to learn that these pets were scanning and pacing and panting and showing signs of agitation and just misery, frankly, in their person's absence. But they weren't damaging anything. They weren't soiling. They weren't tearing the drapes off the windows or chewing into the sheetrock next to the door in their attempts to escape. People didn't know. There's a lot of committed pet parents out there who want the best for their dogs and cats, and they don't even know they have a problem. So videos, I mean, how can you go wrong, right? And they can come back in and show you those. They can post them on my Facebook page, and I will comment on them. We're all in this to do everything we can to make things a little better. So separation anxiety in particular, it's a huge problem. I'm not telling you anything because some of these pets are going to come back and people say, well, they're wrecking the house. The dog's doing $1,000 to $1,500 worth of damage a day. People can't afford that. And of course, they crate them and things can get much worse. So some of the things that are going to be tip-offs on some of these cases for you folks in the shelter are these pets just immediately bonding to any person. And I don't want to tell you that you're not special to these dogs, but almost anybody would be because they're so freaked out. So, the dog gets clingy with people, you go in and visit the dog and it's run and it just tries really hard to come with you. And after you've walked away, it's scratching at the gate and it's crying and whining, and only seems content and happy when it's getting personal attention. Just can't settle down any other way. These dogs have a problem. And there are ways that we can help them starting in the shelter. And we're going to get to that in a few minutes. I'm not just pointing out the problems here. We're getting to the solution. An excellent way, an excellent, very safe way of doing it. So what happens when they get home? Well, of course, many people are going to point out that, gee, this dog bonded immediately. I've never had such a committed relationship with a dog so quickly in my life. Well, that isn't completely normal. Let's face it, a dog who's just moved into a new home should be, checking things out and watching and waiting and observing and gathering information, which dogs are really good at doing. They communicate almost continually, and they're picking up body signals, not only from the other pets in the home, but from the people, and they're listening to what's going on inside the house, outside the house. And the dog who really pretty much has it together behaviorally takes a little time to fit in. and to connect and to bond. But a dog with a real strong tendency for separation anxiety, these guys, they're on their new person immediately. People feel real good about that, but it's actually not the best symptom. People say they're the sweetest dogs. I mean, they certainly can have other manifestations of anxiety, including fear-related aggressive reactions, territorial behaviors, food-related aggression. Dogs with anxiety can manifest it in multiple ways, but the classical separation anxiety dog is just delightful, and people think it's the most wonderful dog and can't figure out how or why it was ever surrendered to a shelter until they leave it alone. Now, some of these dogs are going to start frantically destroying things, trying to escape the house on day one when they're left alone. But some of them, that doesn't develop for a few weeks. But after a few weeks, those things are going to start happening. And so you can set people up and their new dog for success, even if they have a history of separation anxiety. But some of these dogs, they don't eat or drink until the people come back home. Sometimes, and folks don't necessarily mention this, you have to ask the right questions. If they come back in for behavioral help, and many shelters have a mighty good behavior help team nowadays. So ask the right questions. When you come home, besides the overly exuberant greeting, which is a red flag, dogs, yeah, they should be happy to see their person, but out of their mind with exuberance like, oh my goodness, I thought I was going to die. That's not healthy, especially with a dog that people have only had a short time. But then the dog, immediately after it gets over this wild and out of control exuberance, goes over and drinks and drinks and drinks and drinks. Well, why wasn't that dog drinking while it was alone? Wasn't it thirsty? Well, if they're super anxious and, they're just tied up in knots, normal, appropriate physical behavior doesn't occur. They might be pacing and panting and scanning and going to the window, maybe urine soiling, even fecal soiling. If they're really stressed out, the stool is liquid diarrhea. And then, of course, when the people are at home and dog is much better, their stool returns to normal. Checking a stool sample for parasites, always a smart thing to do. But oftentimes this is high stress is the real problem. So we've got a dog here who's just exhibiting out of control behaviors, and eating and drinking only when the person comes home tells you that in the absence of that person, the dog was highly stressed. So these are the kinds of things that you want to be explaining to people. Ask them if this is what's going on. Now, of course, there have been treatments for separation anxiety for a long time, including these kinds of behavior modifications. They certainly have value. Diminishing the dog's reactive behavior towards indicators that it sees as its person is preparing to leave, that's when their anxiety is starting to ramp up. It doesn't just occur while they're alone. As the person does one step after the next in the inevitable direction of walking away, the greatest horror for a dog with this problem, the dog's anxiety ratchets up another level. Well, people need to be aware of that, and we can desensitize to that stuff. We can teach the dog to be more independent. Graduated absences, the old standby where we have the person leave for increasing periods of time, every now and then coming back to a shorter period. All of these things can have their place, as well as medications can be necessary in many of these. But with these behavior modifications, these things are only going to be helpful if we can control the dog's anxiety. We have got to get our arms around it and diminish that, because with all those excitatory neurotransmitters just racing through a panicked dog's brain, even if they have learned some of these improved behaviors, they really can't apply them any more than they can eat or drink sometimes when they're home alone. And so again, medications can have their place. Unfortunately, some of them take longer to work. They don't always work. Occasionally we have side effects. We've got to make adjustments on those things. It can take time. It's not that medication is a bad idea, but there's something that can work much faster. And that's what we have on this cute little red poodle here, wearing this thing looks like a halo, and it's held in place by this little comfy outfit that's called a vest. So let me talk to you about this thing a little bit. This is a new development. The technology behind it has been around a while. Something very similar is being used in psychiatric cases in people. And if I could just stray for a second from veterinary behavior medicine, a lot of our studies have their roots in human behavior studies. What's going on in the neurochemistry of a dog or a cat's or other species brains, the circuitry, where these emotions and motivators and memories come from in various parts of the brain. A lot of this comes from human research, and a lot of the human research is based on animal research, so there's a lot of interaction going here. And so much of this technology of the calmer canine from Assisi Animal Health, has been based on human studies, and this is FDA approved. The calmer canine has been FDA approved for separation anxiety in dogs. Does not involve drugs. There's no sensation. I'll show you a picture of this device as it sits right behind the dog's head in just a minute. And these dogs have no trouble at all with it. Twice daily sessions, 15 minutes each. The device turns itself off, and in 4 to 6 weeks, most of them are significantly better. And you can use it in combination with medications if needed and behavior modifications. So here's some of the research that's been done on it. It had to do with real honest to goodness cases, dogs who really had severe problems that were documented by video studies, and their people followed a protocol. They used questionnaires to document the pet's behavior, and of course, with these graphics down below, you can see how the calmer canine device sits right behind the fear center of the brain, the amygdala, and it really makes changes in the microglia, the functional cells of the fear center of the brain. And like any good study, they point out, well, these are the things that could be what we call confounding factors, things that might have influenced the results that we may or may not be able to control for. And of course, part of that's what's called caregiver placebo, because when these dogs are wearing this thing, they're with their person very often. And you see this dog here in this person's lap getting reinforcement. The touch and the, which is a huge reinforcer. We've got studies that show, when you're teaching a dog things, food is a great reinforcer. Verbal praise is another very potent one. We come to learn that the touch, the petting, is the biggest, even from people a dog doesn't know. So here, this person is holding her dog while it's getting its twice daily 15-minute treatments. She's releasing the hormone oxytocin from this dog's pituitary gland, and it is being released by hers. That's why, we pet people who touch our pets and hold them and have physical affection. We're actually happier and healthier in a broad sense than non-pet people. Well, this dog's calm emotional state at this moment is being reinforced by its person. So caregiver placebo effect, hey, what's wrong with that? You give medication, you don't hold the pet for 15 minutes twice a day after you've given it. Again, not to dump on medication, but there is benefit to this beyond the neurochemistry that we are adjusting with it. So here's how it's used, and you can see the person in the upper left corner is holding it in place. Nothing wrong with that, but having people spend the extra $25 for this little vest that you're seeing down below on the Irish setter, you're seeing the device being stuck on there. It's very lightweight, it's held in place, and these dogs just are very happy to do it. And again, some of them are better in just a couple weeks. Here's a story I'll share with you very briefly. This dog was a rescue. It was clear to its new people that it had some rough treatment prior to them getting it, and it was kind of a mess. They tried crating it like so many people do. Dog escaped the crate. They fastened the crate closed with zip ties. Not the best path that makes sense to people, but these dogs get even more frantic, and Of course, some of them are going to fracture their teeth, cut their lips, break their nails. You know, it's not the way to go. Medication was somewhat helpful, but they wanted a different treatment. They became aware of the research that was being done. And so this dog, Kita, was one of the early cases, and she responded beautifully. And in fact, the folks who owned this dog, who adopted her, one of them was a veterinary student and found that, gosh, maybe the separation anxiety is manageable. So what I'm suggesting that you folks do is have some of these on hand. I'm going to show you in just a second how you can get a really good deal on them. And you can have your volunteers sit with these dogs 15 minutes twice a day and administer the treatment. And if you keep them in stock as an inventory item, you can pass these on to your adopters. They can continue treatments that you folks have started, and they can, again, you can sell them to them if your structure allows that, and they can get a good deal on them from you. So more on that in only a minute, but something that I'm offering, when you have adopters who need help after they get home, they can attend virtual conferences consultations that I'm scheduling for these people at a reduced cost. We're keeping the groups small so that I can give individual questions and answers to people. And they can find this out on my website, which is Dr. Jeff Nichol, Dr. Jeff, Nichol.com. And if they subscribe, they'll get my Facebook Live videos, which I do essentially every week, and my weekly Q&A blog that's published in the Albuquerque Journal. And of course, I'll also send them my free at-home pet first aid and CPR